Hello everyone, welcome back to the channel. Today we want to talk about something very important. It's about shortness of breath. Have you ever experienced shortness of breath? Have you ever struggled to breathe? Maybe you are doing your normal daily activities like walking, climbing stairs, activities requiring minimal effort, and you found yourself struggling to breathe. So today we want to see some of the possible causes of shortness of breath and when it is necessary or important to seek medical attention. So welcome back to the channel, and let's see some of the possible causes of shortness of breath and what we can do in case we might experience these signs and symptoms. Now, what is this shortness of breath? It's a feeling that you are not getting enough air when breathing, or you have to work harder to breathe normally. So it normally happens when somebody maybe is doing an exercise, but when it happens when you are doing daily normal activities like walking or while you're resting, that means there's something wrong, there's something underlying. You need to seek medical attention. So number one cause is lack of physical fitness. It is basically being unfit. If you are not used to regular exercises, so activities like walking, running, and carrying something heavy might make your body breathe fast and feel out of breath. But this one improves with rest, and with regular activities, your body regains fitness, and this one improves. Number two cause is asthma attack. People with asthma attack experience shortness of breath. They present with wheezing, coughing, chest tightness, and these triggers are caused by cold, dust, smoke, and all other kind of allergens. And this one requires a medical attention to resolve these symptoms. So number three is chest or lung infection. These are infections targeting the respiratory system, like for example pneumonia. These infections attacks the lungs and causes shortness of breath. So it presents like pneumonia, for example, presents with fever, painful breathing, coughing, and actually chest tightness. So like the asthma, this one also requires a medical attention to be resolved. And number four cause is severe anemia. Anemia lowers the red cell count in your body system, and remember, the red cell is the carrier of oxygen through the body system. So with limited blood cell, or rather red cell, there is lower amount of oxygen in your system, and this one causes shortness of breath, more especially with limited effort application to your activities. And like other conditions, this one requires a medical attention too to be resolved. Number five is anxiety or panic attack. So when somebody is very anxious or is having a panic attack, often presents with shortness of breath, a racing heart, and they often feel like they don't have enough oxygen, even though their oxygen level is normal. So this one too requires a medical attention to get resolved. Number six is heart problem. Remember, your heart is the pump that pumps blood and oxygen throughout your system. So when the heart is having an issue, there will be a limited supply of blood and oxygen through your system, and you will experience shortness of breath. And this one too requires a medical attention to get resolved. And number seven is a sudden emergency. For example, a clot may dislodge from somewhere in a part of your body and move to the lungs and block the lungs. This will cause shortness of breath, a condition we call pulmonary embolism. This one will cause shortness of breath, sweating, and this one is a medical emergency which requires an emergency medical attention to get resolved. Now, when to seek medical help? If you are experiencing sudden shortness of breath, you're very weak, your chest is very tight, you are coughing blood, and actually your lips turn gray, bluish, you are supposed to seek an emergency medical attention for assessment and proper management of what could be underlying. Remember, shortness of breath doesn't necessarily mean something very serious. It might be that you have aggressively exercised and you are physically unfit. But if you experience shortness of breath even under normal circumstances, like when you're doing daily activities like walking, jumping, moving around, and you experience shortness of breath regularly, please, you need to go for a checkup and assessment from a medical provider so that it can be identified what is the cause of your shortness of breath. And finally, if you found this video helpful, please consider liking, sharing, and commenting. And if you're new here, please consider subscribing, liking, and sharing our content.